Hello everyone, welcome back to my channel. So in today's topic I will be focusing on the menstrual cycle and precisely on those with an irregular menstrual cycle. So today I'll be telling you how to calculate your menstrual length. I'll also be telling you the cause of an irregular menstrual cycle, and I'll also be explaining how you can determine you have an irregular menstrual cycle. And also I'll be telling you some of the things you can do to convert back your irregular menstrual cycle, making it irregular. So all of that I'll be telling you in this video. I'm sure if you are probably watching this video, it's because maybe you are having an irregular menstrual cycle. So keep watching, but don't forget to share this video with others that it might help them equally, and make sure you subscribe, turn on the notification bell, and don't forget to give a thumb up if you find this video very interesting. So my name is Yvonne. If this is your first time watching me, you are very welcome, and for all my returning subscribers, I'm so happy to have you here always. So let's go, guys. Normally, an individuals, they have a menstrual cycle between 21 days to 35 days. So if your menstrual cycle it's less than this 21 days, meaning you have an irregular menstrual cycle, it's not falling within that range. If yours also it's more than 35 days, meaning your menstrual cycle it's also irregular. So those are some of the things you have to take note. That's why each month you have to pay close attention, observing your menstrual cycle, and also to know how long it took before the next one came over. So normally the menstrual cycle it's within a 21 days period and a 35 days period. Anything less than 21, anything more than 35 falls within an irregular menstrual cycle. And before I get to this, like many people, they get confused. How do you know your menstrual cycle length? So I'm going to be telling you also, for you to count the days, many people, they usually make a mistake. They will count and maybe they are not counting correctly, so definitely they cannot get the right figure. So just stay tuned, keep calm. I'm going to tell you how to calculate that. So for you to be able to calculate this, you need to start from the first day you started bleeding. Yes, let me say for example you started bleeding today, the 14th. You are going to start counting from today, which is day 14. Today will be the first day of your menstrual cycle length, and you are going to end the counting the day before you start bleeding again. So let's take for example you started bleeding again maybe on the 6th of next month. So you are going to end the counting on the 5th. That's the day before you start bleeding again. So that's how you calculate your menstrual cycle length. You start the first day you start bleeding, and you are going to end the day before you start bleeding again. That's the menstrual cycle length. So many people have it within 21 to 35 days. So the first sign you know you have an irregular menstrual cycle, it's if your menstrual cycle it's less than 21 days. For example, yours it's coming maybe 18 days, 15 days, you are already starting another menstrual cycle length. And also if it's more than 35 days, like for example you have a 41 days menstrual period, you have maybe a 38 days menstrual period, it's very long, it's more than the usual range. So definitely with that kind of menstrual cycle, you should know you have an irregular menstrual cycle. So the second one I'll be talking about, it's if your menstrual cycle has a duration of more than 9 days. For some people, they have a menstrual cycle that goes more than 9 days interval. Like for example, this month you might have a menstrual cycle of 28 days, and the next month maybe you have a menstrual cycle, maybe let me say of 39 days, and the next month maybe you have another menstrual cycle of 27 days. So if you look within this range, you see that most of this menstrual cycle has an interval of 9 days. So with that kind of an interval, definitely you should know you have an irregular menstrual cycle. So the next one I'll be talking about, if your menstrual cycle you tend to have a very unusual heavy bleeding or very light bleeding as compared to the way your menstrual cycle have been coming, and it comes with a lot of cramp, a lot of pain, issues like that, definitely you have an irregular menstrual cycle. So the next point I'm going to be talking about is if you have a menstrual cycle that maybe after 3 months you don't see your menstrual, you don't see your period, and maybe 2 months, 3 months, it skips for a very long period of time, and of a sudden it just pop up and you start bleeding and then it starts back all over, that is an indication that you have an irregular menstrual cycle length. So those are the factors you have to pay close attention, and then you monitor them. And also, you know, normally an individual is supposed to be bleeding between 2 to 7 days. So if in your case you are bleeding for more than 7 days and it's very heavy, meaning you have an irregular menstrual cycle. So take note of those small things. So the next point I'll be talking about is in between your menstrual cycle. And like, for example, you had this month, you had, let me say, for example, you had a 28 days menstrual cycle, and in between, within, after you stop bleeding, as your menstrual cycle is going, meanwhile it's not yet another 28 days, and you find some kind of small spotting in your pants, like small bleeding in your pants. And also for those that are getting into menopause, you are finding some kind of spotting in your pants. That is an example that you have an irregular menstrual cycle length. So now you all know like examples of an irregular menstrual cycle length. Let's go into it. What can be the cause of this irregular menstrual cycle length? So now I'm going to be telling you some of the causes that can lead you to have an irregular menstrual cycle. The first on my list can be stress, anxiety. When you are very stressed, it tends to affect your hormones in your body. So if you discover in a month that you are very stressed, you might have an irregular menstrual cycle. Your menstrual cycle might not come the exact time it usually used to come. Maybe it might come a little bit early, it might come a little bit late. It might be as a result of the stress. The second factor I'm going to be talking about is regarding puberty. For a teenager who just approached puberty, most of the times, for some of them, their menstrual cycle might not be regular. Like, for example, they might have their menstrual flow this month, and it might take some time. Maybe after 1 month, they might not still see the menstrual period. So with that, it's still struggling to stabilize. So it's a little bit irregular. So the next factor I'm going to be talking about are for those that within a very short period of time, you tend to gain a lot of weight. And also within that short period of time, for some other individuals, they tend to lose a lot of weight within a very short period of time. That is also going to affect your menstrual cycle length. So most of the times, your menstrual cycle might be irregular. You might not have it the way you used to have before. It might be as a result of that excess weight gain, or maybe as a result of the excess weight loss. And then the next factor I'll be talking about is regarding vigorous exercise. For example, if you have done a very strenuous exercise within that time, it might also affect your menstrual period. It might make it either to be too long or too low, or maybe you might not even have your menstrual period. So those are the things that might affect your menstrual period, making it being irregular, because it's not going to come at the usual time it used to come. So it's going to change in pattern, making it being irregular. The next factor I'm going to be talking about are for breastfeeding mothers. When you put to bed, you are breastfeeding, all of those hormonal activities that are taking place in your body, they might stop your ovary from releasing egg. They might slow down the process of ovulation and your total menstrual cycle. So during that period, you might not be bleeding, you might not be having your menstrual period, and definitely that is going to affect your menstrual cycle length. So for some people, after they put to bed and they start breastfeeding, they might not see their period for some period of time, maybe for 1 month, 2 months, and even 3 months. So those are the factors that might cause you to have an irregular menstrual cycle. The next factor I'm going to be talking about for people who are pregnant. You might not have your menstrual cycle, or it might be irregular as a result of the fact that you are definitely pregnant. It could either be maybe normal pregnancy. If you have an ectopic pregnancy, it's also going to affect your menstrual cycle length. For example, if you were pregnant and you miscarried even without knowing, all of that, it's going to affect your menstrual cycle length. So for this point, if you are pregnant, if you're miscarriage, or you have an ectopic pregnancy, definitely it's going to affect your menstrual cycle length, and you are going to have an irregular menstrual cycle. And the next factor I'll be talking about are for those on contraceptive pills. I know many women out there, especially those that have put to bed or those that are on contraceptive pills, you have experienced this. At a point in a woman's life, most of the times you might have irregular menstrual cycle, but you just need to take note. look through, monitor your body sign. What are the things that you have done this month that might have affected it? With that, you might equally have a clue like what can be the reason for you having that irregular menstrual cycle for this month. So for those that are on hormonal contraceptive pills, most of the times when you stop your medication, your menstrual cycle, it's usually irregular. For some people, they might not even see their menstrual cycle like for 1 month, 2 months, and even 3 months. And for some people, even more than that. It goes on for a very long duration. But for some people, after they stop, their menstrual cycle might pop up. Maybe they might have their menstrual period, and maybe the next month it might not come exactly. It might still be struggling and fluctuating. So that's always the cause. So you need to think, what have you done or what have you been on? It might also be maybe due to some medication. So those things are going to affect your menstrual cycle length. The next factor I'm going to be talking about is maybe an illness, maybe an underlying condition. It could either be maybe you have an underreactive thyroid gland, or maybe you might have cystic fibroid. So all of that might also affect your menstrual cycle length. Or maybe it could be an infection, an illness, a virus, or maybe a strong medication you are on. So all of those things can affect your menstrual cycle length, making you have an irregular menstrual cycle. So when you start having an irregular menstrual cycle, go back. You have to think, what are some of the things you have done that are a little bit different from your normal routine? Is your mental state okay? Are you on some medication? Are you very stressed? Are you having anxiety? All of that you have to put into play. You have to think to know, because normally your menstrual cycle is supposed to be regular, consistent. Each month is supposed to be consistent, and you are supposed to be having your menstrual period monthly. So when you don't have them and it's also coming on and off, meaning there is a problem, and also it could equally be there is a problem. So that's why you have to monitor your body to see if your menstrual cycle it's regular or if it's not regular. So take note with such things. The last point I'll be talking about is for someone who is approaching menopause. Yes, when you start approaching menopause, like for ladies that are 45 and above, most of the times your menstrual cycle will not be regular. Maybe it might come a little bit too early, it might come a little bit late, it might totally not come, and the next previous month or maybe after 1 or 2 they might see their menstrual cycle. At times even it comes with spotting. So all of those things, it's showing that you have an irregular menstrual cycle. And one thing I have to talk about this is that most of the times irregular menstrual cycle is usually as a result of something that has changed within your body. So that's why if this irregular menstrual cycle persists, especially if you have a lot of pain, cramps, or you have heavy bleeding as compared to the way you usually bleed monthly, you have to visit a doctor, because this is an indicator that something is definitely wrong with you. Something is not all right. So it's good to visit a healthcare practitioner, and they are going to check. They will either do you a scan, and they will see what is wrong. They would ask you what you have been doing, if you did something different, if you are stressed, all of those things, to see the underlying cause, what can be causing you to have irregular menstrual cycle length. So those are the things you have to take note. Once you start noticing all of these changes I've listed, please kindly visit a doctor. If you know it's as a result of stress, or maybe excess weight gain or excess weight loss, or maybe as a result of vigorous exercise, you can equally adjust that. Or maybe as a result of hormonal contraceptive pills you have been taking, you can equally adjust that, and just be patient. Everything, it's going to be normal. But if it's something that it's not within those ones, it's better for you to visit a doctor so that they check what is wrong with you. So if you have been watching up to this point, what are you waiting for? Why haven't you yet liked or subscribed? So please kindly like, subscribe, and share this video with your loved ones. It might equally help someone to know what to do. And also stay tuned on my channel. I have more interesting videos in this channel. If you haven't yet gone through them, just go through them. You might see another video that is very helpful for you. Okay, I love you all, and please do stay safe. Ciao.